First, I'm going to tell you something that you know, and then I'm going to tell you something that you don't know. And then we're going to go into quite a bit of detail about what you currently probably don't know. And also, hint, your doctor may not know about this either or may have forgotten it, secondary hypertension. So you already know that millions of people around the world have a diagnosis of hypertension, high blood pressure. What you may not know is that up to 20% of these people have something called secondary hypertension. This is far too common to be so greatly underdiagnosed. Now, what's the difference between primary hypertension and secondary hypertension? By far, the most common diagnosis is primary hypertension or essential hypertension. Now, what the average doctor means by this is that, oh, you have high blood pressure, but we don't really know why you have high blood pressure. What I found in my 22 years of clinical experience and reading tons of research papers is that primary hypertension, essential hypertension, is almost invariably caused by hyperinsulinemia. And that's why a ketogenic diet or a carnivore diet, which lowers your insulin back to low normal levels, is so good at reversing primary or essential hypertension. Now, secondary hypertension is different. There's actually a medical cause for secondary hypertension that your doctor should be looking for. Because remember, we said 1 out of 5 people with high blood pressure have secondary hypertension. This could be an endocrine problem with your hormones. This could be a kidney problem. This could be a thyroid problem. This could be an adrenal problem. So I'm going to go through this because the problem here is that many primary care healthcare providers either didn't learn about all the causes of secondary hypertension and what tests you would order to diagnose them, or they're so busy with essential hypertension because it's 80% of the cases that they see. And then often they assume that the other 20% of secondary hypertension is also essential hypertension. Doctors are taught in medical school that when you hear hoofbeats, you should think of horses, not zebras. And the meaning behind this is that you should always consider the most common cause of a disease or a condition. And so when they hear hoofbeats, aka your blood pressure's high multiple times, when you're checking it properly at home, then you probably have 80% of the time it's primary or essential hypertension. And they're right to think that. But if your blood pressure is weird in some way, and I'm going to get into the ways that secondary hypertension is weird compared to primary or essential hypertension later in this video, then they should immediately start an investigation to look for causes of secondary hypertension. And the things that they look for should be based on your age, on your condition, how high your blood pressure is, how your blood pressure responds to the medications that they're trying to lower it with. I'm Dr. Ken Berry, a family physician. Let's talk about this hidden cause of high blood pressure that your doctor may not know about. Now, let's first cover the signs and symptoms that your high blood pressure may have a secondary cause. The first starts on the physical exam, which your doctor should do a thorough physical exam on you at least the very first visit, and then typically once a year you should complete another thorough physical exam where they actually put their hands on you and examine your body and listen to you with a stethoscope. So if they detect that your arm to leg systolic blood pressure is more than 20 points different, that can be a sign of secondary hypertension. If you have delayed or absent femoral pulses, those are the pulses in your groin, then that could be a sign of secondary hypertension. If you have a heart murmur, when's the last time your doctor listened to your heartbeat? If you have an abdominal murmur, called a bruit over the kidney arteries, this can be a sign of secondary hypertension. If you have any increase in your creatinine level, which is a kidney lab, or any sign of kidney malfunction or dysfunction, then that increases your risk that your hypertension is actually secondary hypertension. Now, the reason we care so much about teasing out secondary hypertension from primary hypertension is for 2 reasons. One, often can actually fix the underlying root cause of secondary hypertension rather quickly with a procedure or with a specific medication. And then second, if you have secondary hypertension, that often puts you at risk of having another underlying undiagnosed medical condition that may be causing your secondary hypertension. Any indication of kidney disease or kidney damage, if you start an ACE inhibitor or an ARB, these are blood pressure medications, and you have a weird response to it, or your kidneys suddenly showing the blood blood work that these are damaging your kidneys, that could be a sign of secondary hypertension. If you have a fast heartbeat or a slow heartbeat, if you feel always cold or you feel always hot, if you have chronic constipation or chronic diarrhea, if you have an irregular, heavy, or absent menstrual period, all those things can be a sign that you may have secondary hypertension and should be investigated thoroughly. If you have ever had a potassium measurement in your blood that's even 1/10 of 1 point low, that could be a sign that you have an underlying secondary cause of hypertension. If you have apneic events during sleep, if you stop breathing while you're asleep, your bed partner says, dude, you stop breathing all the time. If you have daytime sleepiness, if you snore so loud that it wakes the neighbors up, these can be signs of a cause of secondary hypertension. If you have facial flushing, if you have headaches, if you have blood pressures that are some days normal and some days super high, if when you stand up your blood pressure goes very low, if you have heart palpitations very frequently, if you just have episodes where you sweat for no reason, or if you have episodes where you either pass out or you almost pass out, and those are repetitive, those can be indications of secondary hypertension. Also, if you have a hump of fat on your neck, known as a buffalo hump, if you're very obese right in the middle of your body, but your arms and legs are kind of skinny, if you have a very round face versus a more normal shaped face, or if you have stretch marks for really no reason and lots of very noticeable stretch marks, these can all be signs of secondary hypertension. Now, keep in mind that 1 out of every 5 people watching this video with high blood pressure has a secondary cause of that could be corrected, that needs to be discovered, investigated, diagnosed, and treated. And so this could be you. And so if you have any of the symptoms or signs I just went over, if you have blood pressure that's still high, even though you're taking 2 or 3 or 4 different blood pressure medications, you might have secondary hypertension and you need to have that investigated. Now, to be very honest with you, many primary care healthcare providers are not knowledgeable enough to know which tests to check. And so you might initially want to get this worked up with your primary care provider. But if they don't find anything and you still harbor a suspicion that your blood pressure is somehow weird, it's not acting right, then you should probably ask for a referral to a cardiologist who specializes in hypertension, or even an endocrinologist, so that you can be fully worked up and make sure that you don't have secondary hypertension when you've just been diagnosed with high blood pressure. Now, remember earlier I said that it depends on your age as to which cause of secondary hypertension you might have. In kids from 0 to 12 years of age, we're going to be really looking at the kidneys, looking for an inborn renal defect, or looking for coarctation of the aorta. In kids 12 to 18 years of age, we're going to be looking again at the kidney very closely and at the aorta very closely. In young adults from 19 to 39 years of age, we're going to be looking at the thyroid. We're going to be looking at fibromuscular dysplasia. We're going to be looking again very carefully at the kidneys to look at the renal arteries and the kidneys themselves to make sure there's not a secondary cause of high blood pressure hiding in the kidneys. For adults from age 40 to 64, we're going to be looking at the adrenal glands. Aldosteronism is a very common cause. Thyroid dysfunction, again in this age group. Obstructive sleep apnea. Yeah, that can cause secondary hypertension. Pheochromocytoma is an adrenal condition that can also lead to very severe secondary hypertension. Now, in adults 65 years of age and older, we're going to be looking at atherosclerotic kidney disease. So really looking at the renal arteries to see if there's a plaque buildup that's blocking the blood flow, and that can cause severe hypertension. We're going to be looking for signs of renal failure, which can also cause secondary hypertension as well, and then hypothyroidism in this group. Now, these categories, based on these different age ranges, are not set in stone. If you have a 10-year-old child who's severely obese and has high blood pressure, they may have sleep apnea. So just because you don't fall into one of these age categories, this warning goes for patients and for doctors, just because you don't fall in that age category doesn't mean that you definitely cannot have that cause of secondary hypertension. Probably the most often missed cause of secondary hypertension is primary aldosteronism. This is an adrenal hormone defect. Up to 10 to 15% of people with hypertension, high blood pressure, can have this, and it just hasn't been caught by their doctor. Another quite common cause is the renal parenchymal disease, which is can be glomerulonephritis, polycystic kidney disease, and other kidney conditions as well. This is probably 2 to 5% of people with high blood pressure. They have kidney disease, and their doctor just hasn't discovered it. Another is renovascular hypertension. This is probably 1 to 2% of cases of hypertension. Can be caused by the narrowing of the arteries supplying the kidney with arterial blood, like renal artery stenosis. And so it can be due to atherosclerosis, but it can also be due to fibromuscular dysplasia. And so this has to be teased out, because if you have any of these secondary causes of hypertension, first of all, you're obviously at increased risk of heart attack and stroke because you have high blood pressure. But secondly, you also are not going to respond to the blood pressure medications because you don't have just essential hypertension, which is going to respond with 80% of cases, and it's going to respond to a very low carbohydrate diet because it's essentially hyperinsulinemia. And so that's why keto and carnivore work so great for primary or essential hypertension. But if you, so if any of you guys have adopted a proper human diet, low carb, keto, ketovore, carnivore, and yet your blood pressure is still much, much higher than it should be, it has not returned to normal, then that absolutely is a sign that you probably have a secondary cause of hypertension, and you should talk to your doctor about this. If they feel comfortable working it up, fine, let them begin. But you may need to wind up in a cardiologist's office or an endocrinologist's office who specializes in high blood pressure. Now, here's another thing that you probably didn't know. There's a pretty long list of medications that can cause secondary hypertension. So this is a medication that your doctor's prescribed for you for some other condition. And one of the side effects of this medication is that it has raised your blood pressure to the point where you now classify as having hypertension. Any of the cyclooxygenase 2 inhibitors like Celebrex or Celecoxib, and this is called different names in different countries, that can cause hypertension in some people, and that's a secondary cause. Any of the non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, Aleve, ibuprofen, Advil, Motrin, Ketorolac, Toradol, any of the anti-inflammatories that you might take for a headache. Many of these medicines are over the counter. Also, there's a large list of them that are prescription, depending on which country you live in. And so many doctors hand these out like candy, almost for free. Like, oh, you've got a headache? Here's a year's worth of ibuprofen or generic Celebrex or some other anti-inflammatory, and these can absolutely cause secondary hypertension. Another of the over-the-counter more herbal things are ephedra, ginseng, and mahong. These can cause high blood pressure in some people. Any amphetamine, including the prescription amphetamines, right, like Adderall, can cause high blood pressure, but then also any illegal amphetamine or cocaine. Any of the illicit drugs can cause secondary hypertension. Cyclosporin, sirolimus, and tacrolimus. These are very uncommon medications, but if you're taking one, you recognize the name just then. Buspar, used for depression and mental health issues, can absolutely cause secondary hypertension. Tegretol, clozaril, lithium, any of the monoamine oxidase inhibitors used for mental health problems can cause secondary hypertension. Any of the SSRIs like Prozac, Paxil, Zoloft, Lexapro, Effexor, in some people can cause secondary hypertension. Any of the serotonin, norepinephrine reuptake inhibitors, again used for mental health issues, can cause secondary hypertension. And then also any of the tricyclic antidepressants can cause secondary hypertension as well. I'm not going to list all these, but if you're taking an antidepressant or an anti-inflammatory, you need to ask your doctor, is it possible that this is contributing contributing to my high blood pressure. For the women, if you are taking an estrogen pill or an estrogen progesterone combo, these are notorious for causing higher blood pressure than you would have if you weren't taking them. In many women, this pushes you over the cutoff for having hypertension, and then you wind up taking a blood pressure medication or 2 or 3, but you really have a high blood pressure caused by your birth control pill or your menopause pill. Any of the steroids, whether it's prednisone, solumedrol, methylprednisolone, any of the steroids are going to have the potential to cause secondary hypertension. And then also any over-the-counter or prescription antihistamine or decongestant can cause secondary hypertension. So if you're taking any of these things every single day for months and months and months, they could be contributing to your hypertension. Although most people don't consider them to be drugs, also keep in mind that chronic abuse of nicotine or alcohol can also lead to secondary hypertension. Now, I've included some research down in the show notes if you want to read further into this, or maybe print that research out and take to your doctor so they'll know which test to actually order if you suspect that you have secondary hypertension. If you have any kind of hypertension, I would highly encourage you to adopt a proper human diet. If you don't currently know what that is or what that means, you can get my free guidebook down in the show notes, a proper human diet guidebook that tells you how to eat and enjoy all the benefits of a very low carbohydrate, nutrient dense, ancestrally appropriate proper human diet. I have several other videos on this channel about high blood pressure and how you can improve it. I'm going to put a link to my high blood pressure playlist down in the show notes, but then also at the end of this video, here, some videos will pop up about hypertension if you want to learn even more. Hope this video helps. This is Dr. Barry. I'll see you next time.